Hey guys, it's Amanda. I wanted to talk to you guys about the progress that I've made with my research project. The topic that I picked was poverty in rural areas. This is a topic near and dear to my heart because I live and work in a rural community. I work with children and families, and a lot of the families that I work with have struggled with poverty. A little background on me. I'm not originally from a rural area. I'm from a more urban area, but my husband's from here where we live in a rural northern Maine. And when we made the decision to move back here and I got my undergraduate degree, I really began to understand that poverty is a much more complex issue than I would have thought it to be in the past. My first experience with this was when I was in my undergrad. My husband worked full time. We both had pretty basic level, starting out, minimum wage pay kind of jobs. And we struggled to make ends meet. We lived on our own from a young age. We had all our bills, all our utilities, everything was on us. And so we went to our local DHS office and we sat down with a worker and we said, look, here's our finances. If you look at our bills and our finances, things really don't match up. We work full time. We contribute to taxes, to our local economy, everything. But we're struggling here. Is there anything that you would be able to help us with? And that day, the worker looked at me and said, there's nothing that we can do for you. My best advice for you is to start a family. Go out and have a kid because there'll be so much more benefits for you. At the time, I was 19, almost 20 years old, and kids were not even on my radar. I had heard those stereotypical stories that you hear about people having a kid every 2 years to keep their TANF or taking advantage of the system, and I was really just trying to go into this honestly and with an open mind, and when I was told that, it kind of blew me away. Now living and working in a rural community, I can see that, poverty is a multidimensional, complex issue. So back to my research project. Initially, I was going to conduct more of like a multivariate type of design. I wanted to explore factors like mental health and poverty in rural areas, or how people get access to resources in rural areas. So my original research questions kind of encompassed a lot. And the more I studied, poverty in the United States and also global poverty, I realized that I really had to be specific about the research that I was going to do. So when it came down to deriving my final question that I was going to ask, I made it, how are social workers addressing rural poverty, and how could social workers be addressing rural poverty in a way that maybe we haven't thought of yet? In pooling my data, I was able to get some studies from countries like India, where rural poverty can grow as much as 10% in a single year. Comparing that to data in the United States, there's similar trends here. One thing I didn't realize is that the most impoverished areas of our country in the United States is the Mississippi Delta. There, poverty is well up over 20% of the population in the Mississippi Delta being considered persistently poor. And what persistently poor or generationally poor means is that it's in a family line, it's 30 years plus sometimes of every family in that family line living below a poverty line, struggling for access to basic resources. So when I started my literature review, I really looked at, okay, well, it's obviously a huge issue, and it's not just here in our immediate communities, but it's a global issue. So what kind of factors kind of contributed to this epidemic of poverty? In doing my research, I discovered that there were multicultural factors, that there were resource factors. So one of the studies that I've been commenting a lot in our discussion board, sorry guys, I just really like this survey, was this research study conducted by Harvey in 2013. He took a kind of different approach. He did a 5-year intensive ethnographic study of the Mississippi Delta. He met with over 70 community leaders and deliberately took opinions from people of different races. I don't necessarily agree with race the race component there, but he really wanted to get to the heart of the issue and what are some culturally sensitive things that we're not paying attention to with poverty. What he determined, the main focus of that study ended up being that white respondents found that economic growth and political power were the key to alleviating poverty. Now, some African American leaders that he interviewed said that no, the focus really should be on community strengthening, civic involvement, just community participation, and social human capital. So from those two concepts, we really have a divide. There's people who believe in the poverty reduction model, and in my literature review, I discussed that. Like, if we give people who are poor access to money, is that going to fix the problem? Now, some researchers have studied that concept, like if we just give people money, it's going to fix it, right? No, because what about access to resources? What about access to basic needs? Just giving someone money doesn't guarantee them access to health care, access to clean drinking water, access to fresh food, access to secure housing. So one of the other theories out there is the tidal wave program. And what the tidal wave program operates out of is the empowerment model. So with that, a group of researchers came together to study, what if we do a community-based intervention? What if we use the tidal wave program and we try something new and we come from an empowerment approach? So their focus was really like, yeah, let's give community resources. Let's give communities education on how they can better support themselves and how they can better support their neighbors. Let's use some empowerment model thinking to motivate people to want to participate in their local government, to want to participate in community events. In the Harvey survey that I mentioned earlier, what he found was that there were some people who felt politically and socially excluded, who felt like their neighbors didn't have their back, who felt like people were lining their own pockets and not really caring about the greater good. So if you apply the empowerment model, the tidal wave program has actually seen change in the Mississippi Delta, has seen communities come together to build resiliency and kind of rally around their neighbors. And alleviate poverty from a multi-systemic approach, not financial, not just economic or political, but also social and civic engagement. I'm just looking at my notes real quick. One of the things that I also wanted to mention was the fact that when I first went into the study, I thought, yeah, this is a quantitative study. I'll get some data on what are the top factors that influence poverty and go by there, like how we can pair them to theories and address them. So when I really started getting into my data, what I found was that there was a lot more qualitative data than there was quantitative data. People have really dug into the topic of rural poverty and said, okay, what is perpetuating this? What are the motivating factors? What are the models applied, the theories? What are communities doing about this? So what I decided to do was design a qualitative study. So in that study, I wanted it to be open-ended, broad, culturally sensitive. The only thing I did add was a qualifying question, being that I would like respondents who have either experienced rural poverty or have worked in a community with rural poverty or just have some basic knowledge or some basic opinions, some basic background on the topic of rural poverty. So I built that into my survey, and some of the questions that I've designed are things like word association, like when you hear the word poverty, what do you think of? For a lot of people, that answer is money. But what about not having access to food, clothes, shelter? All those things could be your immediate response to hearing the word poverty. I also wanted to know if other social workers value addressing rural poverty. Is this something that in the field you feel like we should be a part of? So I did build some questions into my design like that. And I also just wanted to know what kind of resource access my colleagues have experience with. Has it been easy to contact someone about food stamps or Social Security benefits? Has there been red tape in smaller communities around food vouchers, around clothing vouchers, around housing? So once again, I'm going to give you a little background about where I live. My community is considered persistently poor. There are a high number of people on disability. There are also a lot of families with young children who need things like public housing and food stamps and benefits to support their families. So I just wanted to talk a little bit about that for a minute, and just give you guys kind of a snapshot of where I'm coming from. So where I live, there are 3 major public housing communities. Their wait lists for those communities are anywhere from a year to 2 years long at times. So families who come to this area or families who have left and decide to come back are literally can be left without housing for up to a year. So that's huge. Our local towns don't have the funds to supply emergency assistance to get someone in a temporary apartment tomorrow. That kind of money just doesn't exist. And families that have 2 and 3 children, they require more space, and more space means more money. And people assume because our property prices are low and our rents aren't ridiculously high that there would be a way to make a way for those people. But in reality, where I live, that's really not true. People can go long periods of time without housing, without access to clothing, food, shelter. And unfortunately, that means that some people have strayed away from living in our rural community and decide to go to more urban areas. If you're familiar with Maine, there have been a lot of people who've decided, Bangor, Portland, somewhere south of here might be able to get me better help. I do have some background in doing some crisis work and with adults. And honestly, I have sat in meetings where counselors have said, you're better off in Bangor, you're better off in Portland, you're better off in an urban area that has more resources. The drawback to that is, okay, if we move everyone to urban areas, what do we do about rural poverty? Should it still be addressed? In my opinion, I think it should. I think you should be able to live in a rural community and feel supported and feel like being a willing participant in the community. So that's why this topic is really important to me. That's why this topic for me is kind of an educational tool for me. It's more than just resource. It's like, is there something else that I can do that I can apply to my practice? So looking forward, I believe it's a widespread issue. I believe that rural poverty does need to be addressed. I believe that we need some methods or some combinations of methods that we can apply to the topic of rural poverty that make a difference in communities and in people and families' lives. I believe that there's much more that needs to be explored. And like I said, it's a very multi-dimensional area. And I believe that survey results, my survey results, other survey results might be able to show relationships and stereotypes and opinions and stigmas around this concept of rural poverty. So that's kind of really where my focus lies. So thank you guys for listening. I know this video is long. It was supposed to be 5 minutes. We're on 13. But I just wanted to give you guys kind of the background and the basics of where I am. I will be attaching my notes and my citations to this video when I submit it to Blackboard. Thank you guys for watching. Looking forward to seeing you all next term.